morning. My name is Melissa Mosier. We are going to talk about seizures. If you can open your books to page 33, you can follow through with me. And we are going to talk about the signs and what you will do if someone that you are around has a seizure. Some of the signs for seizures will be involuntary movements, rhythmic muscle contractions, staring off like they're daydreaming, abnormal sensations and hallucinations, nausea and sweating, and they could just be unresponsive when you find them or if you come up to them. When someone is having a seizure, you are going to move furniture away from them so that they are not going to hurt themselves if there's furniture. You will place something small and soft under their heads. You are not going to try to restrain this person. You're not going to try to put something in their mouths. And you will call 911. If the person becomes unresponsive and is not breathing, you're going to perform CPR if that person becomes unresponsive and is not breathing. If they are unresponsive and breathing, you're going to turn them onto their side and keep their airways open. If they have had a head injury or a spinal injury, you're going to support their head. You're not going to move them. You're just going to support their head. You don't want to continue to move them. There could be a first-time seizure, or there could be multiple seizures at the same time. Some seizures last longer than 5 minutes, and the injury could be related. It could occur in water. It could occur just out of the blue. And the person could be diabetic, or the person could be pregnant. The person could be, a young child walking into your classroom and has a seizure. You may not even know that this is going to happen. At which time, if that happens and you see this person walk into your room, this child, this adult walk into your room, and they start to have some of those signs that they are not well, that there feels like they are faint, or that they feel like they're sweating, nauseated, have them lie down on the floor and assess that situation. Look around, ask them questions, and if they do go into a seizure, make sure that you have moved people and items away from them so that they're not going to hurt themselves. And as you assess that situation, once again, if they do go unresponsive and stop breathing, you are going to call 911. You are going to start your CPR and your first aid training and go from there. Seizures could be caused by many things. They can be caused by epilepsy. They can be caused by head injury, a stroke, a drug overdose, poisoning, possibly be low blood sugar, heat stroke, and infection of some sort. They're also called febrile seizures, which may occur when the body temperature rapidly increases. And at that time, all the symptoms are the same for any kind of seizure. They may have all of those symptoms, they may have one of those symptoms, but it's always remembering to keep that person safe as they are going through that seizure. Does anybody have any questions at this time?